What a wonderful afternoon to all of you. Good morning or good evening, wherever you're located at this point in the world. So, today we gather to delve into a crucial aspect of healthcare that is reshaping patient experiences and outcomes. And that's the implementation of the person centered care with patient and family advisory councils, or the PFCAC. In an era where patient empowerment and involvement are increasingly recognized as vital components of effective healthcare delivery, the concept of person centered care has emerged as a cornerstone principle. As the person centered care goes beyond the traditional medical approaches by placing patients and their families at the heart of decision making processes. So it really emphasizes empathy, respect for individual preferences, and collaborative partnerships between healthcare providers and patients. Central to this paradigm shift are patient and family advisory councils, or what we call the PFCACs, which serve as platforms for meaningful engagement, feedback, and co-design of care delivery strategies. So throughout our discussion for today, we will explore that transformative potential of person-centered care with PFCACs, examining real-world examples, some of the best practices out there, and the profound impact it has on patient satisfaction, quality of care, and the clinical outcomes. So for today, we invite you to join us as we navigate this critical frontier in healthcare where the voices of patients and their families are not only heard, but also valued as essential partners in the pursuit of optimal health and well being. At this point, I want to check whether you are ready at this point for our webinar, for this very special international webinar. If you can type in right here in the chat box the word quality, that would be perfect. I wanna hear your voices out there virtually. If you can type in right here in the chat box the word quality, that would be amazing. So let's see if our participants are all ready at this point. We received like a more than 100 in terms of registrations for this webinar, and we are expecting that more are coming at this hour. So it looks like a lot of the participants are still logging in. So please type in right here in the chat box the word quality if you are all ready for this webinar. I can see in here, Sharon, thank you for joining our webinar. I can see as well from Miss Lolita, quality, yes, amazing. Mariel, wow. Oh, from Lao. Wow, that would be amazing. Thank you. Thanks for joining. Oh, that's the same name as my name. Thank you. If you can type in right here in the chat box the word quality, let's make our chat box on fire as active as possible so that we can make this a more engaging webinar. Okay, by the way, we are the PSQ Nation. Welcome to the society. We are called the Philippine Society for Quality, and this is one of the key things that we're doing, which is webinar. Sometimes we do a national webinar, national webinars, international webinars. We also do webinars exclusive for our members. So supposedly our host for today, for sure, you are expecting Doc Sans at this point. She is our resident host, but she has something to do at this point. That's why she cannot make it. So I'll be the one to be your host for today. My name is Ray. I'm the current president of the Philippine Society for Quality, and it's really an honor to meet you today and to introduce our dear speaker coming from ISQA. So by the way, we just want to thank everyone for all of you that participated the general membership meeting that happened last month, and we are so thankful for all of the members, all of the sponsors, and all of the supporters and partners that were able to build on that specific event. That was a great success. So we look forward to seeing you more in the future activities and initiatives and programs of PSQ. And by the way, we also want to say thank you so much to Amherst Laboratories for the recently concluded Ugnayan. So that's the benchmarking activity that we did at Amherst. Amherst was the host company. So thank you so much for that hospitality that you showed over to PSQ as well as to the community of PSQ. I believe the participants of that Ugnayan, they had a great time. So they learned a lot at the same time. They had an amazing planned tour. So I believe that's an amazing thing that a lot of the members of PSQ are looking forward to. So please check the upcoming events of PSQ, especially exclusive events for our members. And this is one of the exclusive events that you can take advantage to. So I just want to share with you this super short clip in terms of what happened on that Ugnayan, so at least you had an idea. Wow, that's amazing. Thank you so much. And we definitely would want to celebrate. This is the National Women's Month. We continuously celebrate this month. Last time we celebrated the International Women's Day, and that was a huge success as well in terms of that international webinar. So thank you so much for being part of that event. And it's now available in our YouTube channel, and you can get a copy of that right there, the YouTube channel, and you can access it right there. You just have to type in PSQ Nation, and you can watch it. So it's now available. And by the way, this is still open to all of you who would want to take advantage of some of the prizes or amazing prizes coming from unwritten apparel and accessories. So please don't miss this opportunity for all of the women out there, so you can share, send with us your photo with this gesture. Then you would have a chance to win some special prizes coming from unwritten apparel and accessories. So by the way, I just want to introduce with you once again this international webinar. At this point, this is in collaboration with the International Society for Quality in Healthcare, or ISQA. And we are so grateful for this collaboration, and we would want to continue this collaboration in some of the events or some of the programs that we can have in the future. So when I introduce with you, this is the topic that I introduced earlier. This is the implementation of person-centered care in healthcare with PFCAC. And without further ado, I just want to introduce with you, ladies and gentlemen, our dear speaker, like a super accomplished individual, a super accomplished person. So allow me to introduce Dr. Anuradha Pichumani, an esteemed figure in healthcare quality and safety with over 30 years of experience as an OB/GYN fertility specialist and laparoscopic surgeon. Dr. Pichumani has been a driving force in shaping healthcare standards globally. I know that you've seen like Dr. Anuradha has a very long profile out there on our marketing materials and our promotion materials. As a co-founder of two hospitals in Tamil Nadu, India, she has demonstrated exceptional leadership, notably as executive director of Sri Ringa Hospital and a director of the board of Narbavli multi-specialty hospitals. Dr. Pichumani's influence extends beyond her clinical roles. She serves as a board member of the International Society for Quality in Healthcare, or ISQA, and she holds key positions in organizations such as the Asian Society for Quality in Healthcare, or ASQA, and the National Accreditation Board for Hospitals and Healthcare Providers, or NAPH. Her dedication to excellence has earned her prestigious awards, including the Quality Champion Award by CAHO and the Qualtech Prize. Dr. Pichumani's research contributions, including publications in renowned journals and collaborations with institutions like Harvard TH, the Chan School of Public Health, further solidify her reputation as a pioneer in healthcare quality and safety. So please join me in welcoming Dr. Anuradha Pichimani, whose work continues to transform healthcare practices worldwide.
So good evening to all of you across the world, and especially to Philippines. I'll just try sharing my screen first. Okay. So thank you, Dr. Ray from Star, for those kind words again. And at the outset, I would like to thank ISQA, the International Society for Quality, and the Philippine Society for Quality for giving me this wonderful opportunity to share my experiences in the implementation of person-centered care in healthcare with PFCAC. So I see the year 1969 seems to be very important in the world. One is the humans landing on the moon, and another is formation of your PSQ. So it's quite an old society, and I see it is very vibrant also. And I appreciate the work being done on behalf of ISQA. So I appreciate your society's work in promoting quality awareness and best practices. So thank you for facilitating all these engaging discussions. And moving on, as a ISQA board member, I would like to introduce ISQA also to the participants, which the International Society for Quality has been inspiring and driving improvements in the quality and safety worldwide. Again, it is a non-profit organization dedicated to improving healthcare quality. It's been working for the last 30 years now, and we do this through education, knowledge sharing, and supporting healthcare systems. So it is a vibrant society which spans over 70 countries now. And we have our values as knowledge, network, voice, and action. So knowledge is through various materials which is available on the website of ISQA. Again, it helps you to have a networking with the global community. And you are able to give your voice to improve patient safety and quality. And we are improving the action which is related to patient safety and quality. So this is about ISQA. And moving on. So this is the agenda for today. So we'll be talking about the implementation. We'll have a discussion on the person-centered care, how we are going to redesign our care in our hospitals, and how we are going to form a patient and family-centered advisory council or committee, which will be a step-by-step approach. We shall also discuss some tools and techniques of how we are going to measure it. And I'll give you some examples of the implementation at the ground level, what we have done. Again, we'll talk about the benefits, and as usual, we have so much of challenges also in implementing it, which we shall be discussing further. So at the beginning, we need to understand what is person-centered care. So as discussed earlier, so person-centered care is to have. Can I request others to kindly mute your audios, please? Yeah, thank you. You're able to hear me now? Yeah. So the patient or the person has to be treated with dignity, compassionate care, and respect. The care has to be personalized and also coordinated. Care has to be enabling. And as you see in this picture, patients don't fit into all these boxes, what we have as services. So we need to provide services which will fit for the patient. So that is the reason why we call it as person-centered care, where we are emphasizing the patient's choice. We are giving a voice to their preferences, the values, and their needs. So it's very important we do so. And when we talk about redesigning the care, so this becomes a new mental model when we are going to change the way we have been used to. The way we have been accustomed to is profession-centered. So from profession-centered, it has to be person-centered now. And again, what we talk as professionally defined outcomes, it has to talk about what matters to the patient. Again, it from a diagnostic specific pathways, it has to move towards patient journeys. So this redesigning care is very important, where we are taking care of the system, and the system in turn takes care of the professionals, and the professionals take care of the patient. So this is the way we are going to redesign the care now. So I was talking to you about the patient journey. The patient journey, the person, the journey, and the goal, all three are important. So when we talk about the person has his own health challenge and he's coming into the organization and he is trying to reach some goal. So this goal is defined by, you are going to ask the patient what matters to him or her. So this goal becomes important. When the person is traveling to the system to reach the goal, where the traveling happens, it's called the patient journey. So you have to understand what the patient values most, how we are going to take him through the journey. So this understanding the patient journey helps you to increase the efficiency. It helps you to streamline the processes, again, improves communication within the organization and helps you to minimize care gaps within the hospital in various processes. So this is one of the way we are talking about the continuum of engagement of patients and the family members. So you have various levels of engagement. It's called the Carmen's framework, where you start with the consultation, move on with the involvement, and then it becomes a shared leadership or a partnership. So it can be for a direct care or for an organizational design or for policy making also. So when the patient moves through the system, you are going to take them into so that you are going to help them to engage themselves. So for that, you need to create a system which will be good enough to engage the patients. So when we start engaging the patients, it goes through a model of co-production. So in this co-production framework, you are able to see the patients and the professionals within this framework, where they are going to co-plan and co-execute within the healthcare system. And they also interact outside the healthcare system when it is either through the community or to the society. And with this co-production, you are going to produce something which is a high value for the healthcare service and it creates good health. So this collaboration becomes very important. And that's how we are going to engage the patients. So whenever we are going to talk about this engagement again, so we need to understand the health professionals' dilemma. So every hospital has their own challenges. And when a doctor sees a patient, he has his own dilemma, whether because of his the time constraints or the resource constraints. Again, the professional, the system which works, the system does not allow many of the health professionals to move on with his own way of engagement with the patient. So this patient system meeting becomes very important, where you're going to change this whole system, you're going to redesign the system, because every system is perfectly designed to get the result it gets. So only if you redesign the system, this patient system meeting starts improving, and you have to take care of your frontline professionals as well as the patients as a human being. Only when you do so, then you are able to change the system's goal. You are going to change from a diagnostic-centered one to a person-centered, integrative, and a proactive care. So this is the way you're going to redesign the care. So we are now moving on to the PFCAC. The PFCAC is the Person and Family Centered Advisory Council or the committee. This PFCAC has become a powerful bridge to partnership. So we call the PFCAC, which is a group of patients or family members or caregivers. These people come together and they work together with the healthcare providers so as to improve the quality of care as well as the patient's experience within our organizations. So this is very important because with the help of this group of people, we are going to improve the patient's experience, the patients who are getting into the organizations. So how do you do the person-centered care with the PFCAC approach? So why is it needed? When you see this figure, you have the healthcare providers at one end, family members, and the patients. When the healthcare providers work in a very complex environment, it's very stressful. As we all know, hospitals are a huge amount of stress each and every time whenever a patient becomes ill, a critically ill patient or a patient being brought in an emergency. So you need to understand it is a complex environment. So because of this environment, the healthcare providers are already stressed enough and they don't understand how to take care of the patient's experiences. They don't understand the patient's perspectives. So now this PFCAC helps you to do so, where you form this Person and Family Centered Advisory Committee. And this committee, which includes the family members, patients, and the staff, all of them are involved in this committee. So now the staff are able to understand the patient's perspectives. There is no blame happening here. We are trying to improve the whole processes so that we are trying to improve the whole system. And based on this, you have the leadership support. When you form this committee, you have a framework for improvement. You have a clear focus and on which care experience you're going to improve on. So for each and everything, you need to have an aim, a measure. You have a multidisciplinary team, and the whole thing is going to be seen through the patient's eyes now. So you are going to experience what is happening to the patient. So this is a simple low-cost technology, this PFCAC approach. It takes care of two parallel aspects of healthcare, the process of care and the staff-patient interaction. So this is very important. And so we are going to understand this critical part of how we are going to improve the patient and family-centered council. So this is going to be a step-by-step guide. So I'll take you through 6 steps. The first step is selecting a care experience. You have to define which care experience you are going to change with the help of your committee. So the care experience has to be selected, which has to be defined from the patient's and family perspective. And again, it has to be chosen for the right reasons. So the desire has to be there. The push has to be there in the department to change that whole process. Again, in the second step, you're going to establish the committee. You need to initiate the steps. So this committee will support the whole project. It will help to keep the project on track. It will review the areas of focus. It will help you to assess what has happened, and it also supports the team. So in this step, you have to have 3 champions. The first champion is the administrative champion. The second is a clinical champion. The administrative champion takes a leadership role. The clinical champion will be needed to understand the clinical process which is happening into that project specifically. So it can be a surgeon or a physician if it's involving a patient with a process which involves the operation theater. Then you need to have a surgeon or an anesthetist into your team. So you define which clinical champion has to be taken, but it has to be on a lead role, so that that person has the responsibility of changing some process inside that project. Then you have a PFCAC coordinator. This coordinator becomes very important because this person and family centered advisory committee's coordinator is talking in between it's going to be for the staff in the hospital as well as for the patient side. So this coordinator takes care of supporting the whole team, involving everyone in the communication part. And then you have formed this, and then you move on to step 3 now. In the step 3, you're going to evaluate the current situation and develop a sense of urgency. So to understand the current situation, you need a baseline. So for getting the baseline, you have to take care of your feedback and surveys. With the feedback and surveys, you will be able to understand the experience of patients and their families. And again, you need to understand the staff experience also. So to understand staff experience, we can either take the staff experience survey or some metrics like the absenteeism or the late arrival. So all these things get on with the staff experience. So this baseline has to be there. Then only you will be able to understand what is happening at the ground level. You then identify what you're going to improve on. If there is a gap, if there is some feedback which has been given, a negative feedback in some process, you decide, you identify it, and also you need to understand why you're going to improve it and what are you going to improve it, whether the interventions has been successful previously and what you're going to do as a new project now. Moving on to step 4, you're going to develop some working groups to carry out the improvement work. So these are the team members where you're going to define the roles and responsibility for each and every team member. So it can be a clinical lead, a ward or a clinical champion. So this champion has to be very motivated to keep the team members in the group. And again, you need to have some contact person and some person who is going to write everything about the project. So you develop individual working group based on the project which you're going to take into consideration. The 5th step will be developing a shared vision. So you need to have a vision for the ideal patient experience. So there is something happening at the ground level. You're going to ask the patient to write down what will be the ideal situation which they think. So you're going to compare the story with what actually happens at the ground level. So when it is being written on the patient's voice, you understand what the patient needs. So which are the elements in the ideal experience which have already taken place, which are not happening, and what are you going to do to change it? So if some answer is yes, this will become the focus for the improvement project. So you're going to identify which is the project you're going to take up with the help of your person and family centered advisory committee. So now you have identified, you have collected information, you have selected a project, you have formed a team, then you're going to evaluate it. So to select, you have selected the project based on the perspective of the patient. You assign the project team. So it will be good if you have minimum two leaders. Two co-leaders will be good. One from the staff side, one from the patient side, so that the whole team is taken care of. And then you evaluate the current state, you recruit members. The recruiting members will be based on the resources available, again, the project which you're going to take it up. You have to create a shared vision. You decide which will be the ideal care experience for the patient. And even you can take your own experience, because you would have been a caregiver at any point of time for your family members. And then you have to get on to the work. And every moment you have to acknowledge the work being done by the team members so that they are motivated and you move on. You have these various tools like process mapping, shadowing, and patient stories. So you can use process mapping, which is a visual representation of the transactions, which can occur through the process of care. So for this, you put up a board and put up stickers, post-it stickers, where you're going to individually have what are the processes which are happening, and you have to identify the process which you're going to change. So this will help you to understand the process which is happening within the organization. It can be in the emergency department or it can be in the pharmacy.
Pero tignan mo yung sa mga preview. 14 days, di ba? Kasama yung sa
Ayun na.
Can everyone kindly mute your audios, please? Yeah, thank you. So moving on, you have the second tool, which is the patient shadowing. Shadowing is a direct real-time observation of patients as they move through the experiences in any care setting. So you can decide who can be the shadower. It can be a senior person or a junior person. You select the shadower, and then you gather information, and then you connect with the patient and family experience, and then you report the findings to the project team, and then you analyze their experiences. The third one is patient stories. So patient stories are very important because listening to patient's voice is important. You need to understand how you are going to collect the stories. So it can be from lived experiences, or it can be from the family members who have been with the patient. So patient stories actually add on to patient shadowing. In some of the instances where you cannot do a patient shadowing, like end-of-life care, or the patient is critically ill in an ICU, you can take up patient stories from the family members. It can be done within the organization, and you have to ask what matters to you, so that with the patient stories, you are able to understand how things are done within the department. You can understand the process delays, you can understand about poor communication, and especially the organization can understand what happens between two episodes of care. Between the two episodes, what has happened to the patient, all these come out with the patient stories. So now I am going to move on to giving you some examples at the ground level of what we have done in our hospital. I come from southern India. It's a semi-rural, semi-urban place. It's called the place is called Chengalpet in Tamil Nadu. So India is a land of huge diversity, and we in our hospital we cater to more of rural patients along with suburban patients. So our hospital is more than 33 years old now. I run the organization with my husband, who's a diabetologist. The hospital is called Sriranga Hospital. It's a 50-bed hospital. So what we have done is the leadership role is very important when you're going to have a person-centered care. So only with the leadership self, you will be able to redesign the whole system. So I'll tell you examples of how we have redesigned some departments, how we have listened to the patient's voice, collecting surveys, how we have used Deming cycles, PDSA cycles to improve the patient's experience. The system has to support when you're going to use the patient's journey again. And so you need to understand how you're going to engage the patient in the community and in patient safety, and using some digital tools. And again, how we have utilized the patient and family centered advisory committee. So this is one of the early work which we have done. It's called the experience-based code design. We have taken the King's Fund toolkit from UK. This project was done in the dialysis department, where we started with interviewing the patients and the family members. And then we interviewed the staff separately. We created short videos, and we held a joint session with the staff and the patient to understand the experiences. And based on the discussion, the staff and the patients prioritize certain certain examples of like a quick fix for 10 events. The process redesign were for 12. So we stratified all this, and then we had co-design groups who are working on to redesign the whole thing. And when we have done the redesigning, we had a feedback from the patient. The patient satisfaction improved to 85%, staff satisfaction improved more than 75%. So this is the way we co-design and redesign the work. The second example is about the patient experience, where we have taken this from labor room. We did what matters to you can be done with the help of patients' feedback and the survey and the questionnaires. This is together for her questionnaire, which talks about the WHO 9 quality indicators, which is very important for an antenatal patient. So based on this, the patient satisfaction was improved. Again, the second questionnaire is from Denmark. It's called the Childbirth Experience Questionnaire. Every patient who delivers in the hospital is asked about the every primary, the first delivery. It's very important you create a positive experience for the patient. So based on this, we were able to do some interventions, improve the communication within the staff, within the teams, and the patient experience improved. So moving on, this is one of the examples of how we have used the Deming cycle, the PDSA cycle, to implement a project to improve the patient experience. Again, this is called the Birth Companion Project, where WHO talks about respectful maternal care. To have a respectful maternal care, you need a birth companion. Every patient has to have a birth companion during her delivery process. So we were implementing a birth companion project within the organization. We went through 3 PDSA cycles, and we were able to do some intervention with staff training, giving empowerment to the patients, making them understand what are the emergency signs and symptoms, and we were able to improve the patient satisfaction again. This is one of the examples where we have taken the patient through a patient journey. The person, the journey, and the goal are very important. This we combined with the experience-based co-design. This project was done in the pharmacy, where the patients and the staff were able to take us through the patient's journey, and we were able to understand the process, change certain things based on the co-design groups. When we are going to use a co-design group, the complaints becomes better, because the whole change in the process is being done by the staff who are working in that department. It is not being done by the leadership at all. So they design the process, and the improvement becomes better, and the complaints also improves. Again, person-centered care, it's very important you go into the community to understand them. So you have to build the trust with the community where you're working in. This helps you to understand the community and give an effective delivery. So our hospital has been working with the diabetes and screening, cancer screening awareness camps with the community. We have involved a whole lot of community for all these camps. We have involved the community leaders. We have done various screening programs. Last 20 years, we have been doing this. So it's very important every hospital takes care of the person-centered initiative. We have come up with various innovative ideas to educate the patient, to do the empowerment. We have been using puppet shows, diet exhibitions. We have done various awareness programs in the schools and colleges. So these are various ways where you can engage the community. Again, person-centered care, it's very important you involve them in the safety. We included this person-centered care in medication safety, where we were able to empower the patients, make them understand what medications they are taking in, when they have to take. So the 5 moments of medication safety given by the WHO was very useful. We involve the patients in shared decision-making, in a collaborative medication review, and they were able to report the adverse events also. This the usage of digital tools are very important when we are going to talk about personalized proactive care. And in India, we are talking about a diverse population. So we took the help of various digital tools. And because critical care is very important, we don't have those type of certain intensivists at a certain point of time. So that's why we took the help of tele-ICU, and we were able to improve the patient-centered care within the organization. We were able to take up tele-ophthalmology for a diabetic retinopathy screening, do teleconsultation, teleradiology for giving CT and X-ray reports. Again, the various variables, the monitoring of patients with the continuous glucose test monitoring for diabetic patients, and the BP monitoring can be done. We have the vein locator based on patient feedback. So all these things are various types of digital tools which every hospital can use to give a proactive care. When we talk about, again, patient engagement, so you need to have some metrics. So this metrics, we have taken the PREN tool, the patient reported experience measure tool. This whole tool is a questionnaire. It's a 43 questions based on these 12 initiatives. The 12 are the areas of focus. It includes how the renal team treats the patient, how the support is given, the communication is taken care of, how they are involved in the shared decision making. The whole thing is about the dialysis patient because they are patients who need chronic treatment. So this sprint tool was designed by patients and professionals working together. And based on this, we were able to identify the areas of focus which we were able to implement within the organization and improve the patient's experience. Again, patient engagement is, we can do it with the help of PROM tool also, the patient reported outcome measures. We did this again in dialysis with the DSI questionnaire. It's called the dialysis symptom index burden, which we are talking about the various symptoms which the patients have. Most of the dialysis patients have so much of symptoms. And many a time in dialysis units, the doctors just take care of the urea and creatinine levels and they move on because they are continuous chronic patients. But you need to improve on their daily quality of life. So quality of life is very important when we are going to talk about this cohort. So we were able to get this questionnaire done. And based on this, we were able to do interventions with the help of our nephrologists. And this is the way you improve the quality of life for the patient and improve the experience also. We have been talking about person-centered care with the help of PFCAC group. So to understand the PFCAC, so we started our patient and family-centered advisory committee last year. And the goal of patient and family-centered advisory committee is to ensure the perspectives and the needs of every patient and the family is being included. So it has to be included in the boardroom decisions also, so that you are including them in the decision-making process within the healthcare organization. So we started out with our committee and we have just implemented so many other programs. We have included them in all these programs. Each and every patient and family member have been part of these projects within the organization. We include them in the community and patient engagement where we help them. We ask them to do the education and empowerment of our patients. We also include this committee to improve the quality and patient safety within the hospital also. So you can take up all these ideas and then improve on this. So I'm giving you certain examples of how we have used the patient and family-centered advisory committee. So these are all patients who have been repeatedly coming into the hospital. They have lived an experience. They know about the hospital better than what we know as a leader. So that's how we were able to include their ideas when we are taking them for a facility or safety rounds. And based on that feedback, we were able to implement so many things within the hospital. Again, we have included them in the various community projects. We have started a senior citizen club within the hospital, and the senior citizen club is being run by this committee, run by our PFCAC committee. So the PFCAC committee comes in every month whenever we run the senior citizen club activities. We have various activities like yoga class, counseling session. We run crochet club for the senior citizens of the group also to improve the neurological, the hand-eye coordination is very important when the patient becomes a senior citizen. So that's why we take up so many activities within this organization, and all these activities are coordinated by the PFCAC committee members. Again, we have involved the PFCAC committee in various hospital projects by creating a patient education flyers, creating the patient education booklet, which we send out free to all our diabetic patients monthly once. And we collect patient feedback. Various surveys are being done, collecting the OP and IP feedback, the inpatient feedback. And based on this feedback, we have the committee members giving us ideas how to improve the patient experience. So you can include them when you're going to talk to them about the analysis of the data. And in this way, the committee members are involved within the hospital. Again, we have involved the PFCAC team in various community projects. We run an awareness program on healthy living for all the local school students. So the students in this whole district in our place. So every school is being brought inside the hospital to make them aware of the healthy living, so that the burden of the non-communicable disease starts coming down. Because we have a huge burden of diabetes and hypertension and dialysis and other things within the, which is increasing in every community now. So that's why we are running these awareness programs, and our committee members are part of this in counseling sessions. Again, we have involved them in various Diabetes Day competitions, in cookery competitions, in breastfeeding awareness. We have they have created poster competitions. So for all these, they work along with the doctors, with the staff to check all these competitions, do the judging also. So I have taken you through various examples of how you can utilize the PFCAC committee to help understand and implement the person-centered care within your hospitals. So whenever you are talking about implementation, you need to measure the improvement also. So to understand and measure it, you have the Donabedian model. You talk about the structure, process, and outcome. So for outcome measures, you need to understand how the system is performing. So what is the result? So was the patient's experience better? So this is what you are going to talk when we are discussing about the outcome measure. Again, you have to discuss on the process measure. What are the steps we are taking, whether the care has become better when we are trying to implement a person-centered care. And you have to balance the whole measurement. So what happened to the wider system when we are trying to improve the outcome and process measure? So was there any unintended consequences on the outcomes? So you have to balance it also, because you're going to redesign a system and a process. So all these things have to be measured to see whether person-centered care is being implemented in a good way. So to measure the improvement, you have a goal. So you decide on the goal, what is the goal, and how you are going to collect the data, and how you are going to measure the progress. So for this, you can use these three tools. It can be a driver diagram or a PDSA or a dashboard. In a driver diagram, it's a visual model. So I have given you a template also. You have a primary driver and a secondary driver. So this becomes a visual model which will influence the patient's experience. You are able to understand what are the things which are affecting the patient's experience also. So the primary driver is which will contribute to moving the primary outcome. The secondary drivers are elements which will be associated to create various projects. You are going to change certain things based on these secondary drivers. So in this way, a driver diagram will be utilized. Again, you have the PDSA, the plan, do, act, study, and act cycle. So this is a time-tested model for improvement, which helps you to implement small changes in a small scale. You can have multiple PDSA cycles within a single project, so that you keep on implementing it and improving the process. Again, you can have a dashboard. This is a modern analytical tool, which will again help you to have a visual representation, and it is a dynamic and an interactive process. You understand and improve the patient experience and patient satisfaction. So when you do all this, you have a person-centered care system. And in a person-centered care system, the patient is equal, he is active, he becomes an informed partner. And this person-centered care helps you to have a proactive care, because the patient is able to take part in his own care decisions. So he is able to be more compliant. Again, the person-centered care leads to integrated care. So the integration helps you to improve the resources. You are going to improve the care time. The care is being given in a better way. This in turn leads to improve outcomes. So in this way, the person-centered care is very helpful. And the various benefits are to the patients, to the staff, and to the organization. To patients, the patient becomes more confident, because you are implementing the person-centered care. So they understand the care will be of high quality, and they understand that the care is being designed, and they are being acknowledged about their experiences within the broader lives. Again, the satisfaction improves, the compliance improves, the healthy behaviors for chronic patients, and since they are also involved in various decision making. The benefits of staff is the staff becomes more engaged in the work, because you are going to involve them in every decision, because they are part of the co-designing and in the co-production. So they understand the current experiences from the patient's perspective. So this helps them to implement it. They become more proactive, and they are more motivated to now engage in the work. And they also develop the skill and confidence to move through, and they have more time to provide the individualized care in a standardized process. Again, for the organization, it has huge benefits, because you're making a commitment a reality. So the organization talks about implementing person-centered care. When you have a person and family-centered advisory council, this helps you to make it a reality. So you are improving the patient's experiences, you are improving the safety, the clinical effectiveness, the timeliness, and the whole efficiency of the processes within each department in your hospital. So improving the staff engagement, and the staff become more motivated, and you are able to retain your staff also. Again, the capacity building is improved on. You have various lessons which can be shared across departments, and you build a reputation for the organization that is a high quality and a compassionate care. So any process, any new process has its own challenges and barriers. So when you're going to talk about challenges, there are two challenges now. One challenge is about the implementation of person-centered care. The second challenge is on the implementing and sustaining a PFCAC team. So both we need to understand both challenges and see how we are going to move on. When you're talking about the person-centered care, it's organization level factors where you have some barriers like resource constraint or low employee value, there are commitment, poor staff commitment. So you have to understand the barriers and then improve on it. You have to enable it. You need to have a proper leadership role. The commitment is very important. You have to have the support of technology, and the environment has to support a person-centered care system. So these are the various organization level factors, and you need to have some change agents. So for that, you need to educate your professionals and the public about person-centered care. Again, a good leadership role is very important for the commitment, and the healthcare system has to be completely redesigned to involve the patient and keep the person as the center of all the care and the process within the organization. You might need to redesign outside the healthcare system also, because you are going to take care of the community also. Again, the measurement is very important. Only with some data, you will be able to talk to the leadership, talk to professionals so that they are able to implement the person-centered care. Moving on to the PFCAC. So implementing when you are going to start with the PFCAC team, the energy levels are good, the motivation is good, but sustaining the PFCAC team is always a challenge. So this paper talks about the various workshops which they did, the various surveys they have done based on the patient and family interviews. And based on this, they were able to identify 3 phases of engagement. The 3 phases are the recruit phase, the retain phase, and the sustain phase when you are talking about a PFCAC team. So the recruit phase is the place where you are going to identify some members from the staff, from the patients and the family members, and they are very motivated because they have some lived-in experience. Now they want to change the system along with the hospital staff. But when they move through the retain phase, they have to be continuously involved, because now only if you have you give them some recognition, only if the communication is good, then they are retained within the department as a PFCAC team. Again, then they move on to the sustaining phase. In sustaining phase, you need to work on certain motivations so that the PFCAC team gets sustained within the hospital. So you need to have 7 motivation, which is given in this co-design framework. We were talking about the 3 phases of patient and family engagement roles. So these 3 columns talk about the 3 phases. The recruitment phase talks about why I got involved. It's from the patient's point of view. In the retain phase, the why I continue to be involved. These are the questions which have to be answered when you have to engage patients in the retain phase. The 3rd phase is a sustain phase, which talks about what I need to strengthen my involvement. So these are the 3 phases, and the 7 motivations are given here, which is self-fulfillment, improving healthcare. They need some compensation or influence, or they have to keep on learning new things. This keeps them motivated. You have some perks. So this co-design framework helps you to support, sustain, and improve the patient engagement. Again, we talk about engaging patients for patient safety. This has been given very recently by WHO. It talks about the advocacy brief, where the patient engagement in healthcare is to facilitate and strengthen the role of the persons who are using the services. They have to become co-producers of health and the healthcare policy and practice. When you start engaging patients in their own patient safety, you will have improved health outcomes, you will have a reduction in adverse events, the care cost starts reducing, and you are going to possibly influence the patient experience and in turn improve the patient outcomes. So all these are the improvements which you see when you are going to improve patient safety using the patient engagement. You can utilize the patient and family-centered advisory committee to do this patient engagement. That's why we had the last year's theme on WHO's Patient Safety Day. It was the elevation of patient's voice. So improve on patient safety. So you have to create success stories. So you create your own success story within your organizations. So for that, you need to implement person-centered care within the hospitals. And this care has to be coordinated. The care professionals have to be just visitors in a patient life. The patient becomes the host, the guide, and the enabler of this healing journey. The patient becomes the center of everything, whatever you are going to design within the hospital. The care system's goal is to enable the person to thrive in their life with as little support from the healthcare group as possible. So we are just going to enable the person and we are just going to support him so that he becomes more empowered and he is the part of the decision-making process. So I would like to leave you with this quote. People will forget what you said. People will forget what you did, but people will never forget how you made them feel. So this is very important for you to remember and understand. And person-centered care system has to be implemented across all organizations. And with this, I would like to invite you all to join us, join the ISQA conference in Istanbul in 2024. It's in September 24 to 27. So hope to meet you all there. And the theme is on health for people and planet, building bridges to a sustainable future. Thank you all.
Wow, that was an amazing presentation, Dr. Anuradha. So you're able to cover like a lot of topics around the topic. I was blown away. It's so overwhelming, like taking in all of this information. And I love one of the last slides that you mentioned in there from Maya Angelou, right? You mentioned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. And I think that's because that's one of my favorite quotes from Maya Angelou. And I was like, wow, that's really amazing. It's really appropriate for the topic. Okay, please give Dr. Anuradha a round of applause. Maybe any of your heart reactions right there, or any of the emojis that you can see right there in your Zoom. And please share your questions right here, or any of your insights right here in the chat box. I believe that's an incredible presentation. I really learned a lot, and I can say that I've seen like a lot of the healthcare organizations, and I've seen that we're still not there in terms of the implementation of the PFCAC, or the person centered care. And I think we're still on the traditional, I believe, from my experience, especially these days that I've been like going, like visiting the hospital like on a daily basis because of my treatment of my mom. So I think that I've been experiencing that we're still not there yet, but hopefully this is something that we look forward to in terms of really implementing right here in most of the healthcare organizations right here in the Philippines. So while we're still waiting for some of the questions from our participants, Dr. Anuradha, um, you've covered a lot of topics in there. And one of the key things that you mentioned is all about the barriers in terms of the implementation, right, of the PFCAC. And I'm curious in terms of what are some of the maybe top two strategies that you can share with us in terms of that we can use for us to address that barrier in terms of the resistance to change when we implement the PFCAC in any of the healthcare organizations.
Okay, thank you for that. So I would like to really appreciate you for bringing out this very important topic in this discussion, because the whole world is moving towards person and family centered now. So when we started implementing it, we too had our own barriers. So for beginners, I would like you to read through the various resources. I can help you to send you the resources also. We have various resources on ISQA website. We have 2 or 3 modules on person-centered care, how to implement it. And again, ISQA has brought out a white paper on person-centered care systems. All these resources I can send it to you, Dr. Ray, and you can send it to your participants also. That will be a starting point. And again, we are bringing out a coordinator course now, Person and Family Centered Advisory Committee Coordinator, because this coordinator becomes very important. This he has a critical work within the organization when you are going to implement person-centered care within the hospital. So that's why we are trying to get a coordinator course ready now. It will be put out very shortly. So these are various things when any organization is trying to start out with a person-centered care system within the hospital. And talking about the barriers which we had to move through. The first barrier is first you have to make your staff understand what is a person-centered care system, and they need to change over, because you are used to defining everything on a professional based. It can be the number of deliveries you have seen, or the number of patients, the morbidity, or the number of mortality. So this is the way we take care of outcomes. But patients are not interested in all that. Even if you have done a surgery, patients are more important, more relating to the experience what they had during the journey. So the satisfaction and experience matters. So that's why we need to empower our own the staff members within the hospital. That is the first thing. Second will be your leadership. You need to have a strong leadership who will be able to redesign the system. And then you work through the process. And you need to have a culture of person-centered care, which has to be embedded within the hospital. It has to be woven through every project, whatever you do. It can be a small one, or it can be a large one on a patient safety project or a quality project. Each and everything, like what I showed as example, it has to be implemented within the hospital. So we were also able to move through the barriers, and then we were able to move it as a person-centered care system with the help of our committee now. Thank you.
Wow, that's amazing. And I totally agree with you, Dr. Anuradha, especially if we have like new initiatives, but this one is a huge one, right? That everyone needs to know the why behind the what, and definitely leadership has to be bought in terms of the idea. They have to champion it at the end of the day. That would be great. And I look forward definitely to receiving the resources that you'll be sending out to the Anuradha, that I'll be sharing as well, or that we'll be sharing as well to all of the participants at this point. What questions do you have? I mean, from our participants at this point? I don't know if I heard it right, by the way, Dr. Anuradha, in terms of like the potential cost implication in implementing PFCAC. How can organizations justify this kind of investment?
Okay, that's a great question. So any new project, you might need some resources, but this is a very simple and low cost technology, what we are talking about. We are just asking them to share their experiences, and many of the patients and family members are very much willing to do so. So it doesn't cost you much to get that experience, and then you start redesigning the process. So you talk to them about their stories, their journeys, what they have experienced as a patient. You can talk to your staff members also, because they are also part of these processes, and then start implementing them. During the implementation, you might need some minimal resources based on the projects what you're going to take. It can be a simple quick fix solution, like a small training or a small communication issue. All these things can be done within the department, which will not cost you much. If it's going to be a infrastructure change, like you go through the patient journey, and to reduce the patient's walkthrough within the hospital, you're going to do some infrastructure change. Then you might need to involve your leadership role, and then you might need some more resources. So before you start, before you start on any project, you first try to prioritize it, see what is the resources available, see whether you'll be able to do within the available resources, and then move on. So some simple resources at the start of it, and then you can take up complex projects also. Thank you.
Thank you so much for that, Dr. Anuradha. Yeah, really interesting. And I'm also thinking about definitely that we are involving them in terms of the project. I'm also envisioning, how does it look like when we do some of the awards, or some of the how do we reward them? Like parts of the member of the PFCAC.
Yeah, that's really nice, because you need to acknowledge the work they have done. So what I have done is, so we invite them for all our events, any event which happens in the hospital. Like it can be a Diabetes Day event, or yesterday we had the Women's Day event, which you were showing. So we had a Women's Day program yesterday, where we did cancer screening, mammography, and a pap smear for all the women patients here. So we try involving this PFCAC committee, and we acknowledge the work what they have done. And so this recognition is a big motivation for them. And you need to prioritize whatever they have given us as suggestion. And you need to communicate back to them that you have prioritized those decisions. You have implemented certain suggestions, whatever they have given. When you have done so, they understand that they have contributed to the organization in a good way. And that's how it keeps them motivated. Because I was talking to you about the sustaining this PFCAC team. This sustaining is always a bit difficult because all these, many of the team members are already patients. So they might also fall sick. And so they might take a gap. So we might need to have some other persons so that the project does not stop in between. And then whenever they are able to come back again to the team, then we take them as a team and then we move on with the project. We can even take them on Zoom call, or you communicate to them about how the work has been done. So these are various ways how we have been implementing it, and you need to know how you are going to sustain it, and acknowledging them and informing them that whatever they have given a suggestion is very important to keep them motivated. Thank you.
Thank you so much. That's an amazing insight and answer. Thank you so much, Dr. Anuradha. I cannot see any other questions right here in our chat box, but since we are at the top of the hour at this point, and we are so grateful that we have someone like you, Dr. Anuradha, and we hope that we can hear you more in some of our future webinars, and we would love to see you in person as well. So, so before we present with you the certificate of appreciation, Dr. Anuradha, I just want to let me see if there's a question in here. There's a question in here that's sent to me directly. Maybe we can accommodate this one. The question is, I don't know if this question is related. May I ask if PFCAC is based on ISO 7101 2023 healthcare quality management?
Okay, that's a great question. So ISO 7101-2023, I was part of the project. So I was writing the standards, and I was specifically involved in the person-centered care part. So thank you for that question, especially. And so this ISO 7101 has been written by nearly more than 30 countries now. So we were writing it for last 3 years, and it has been recently published. And so we had members from all the countries, and I represented ISQA in writing it from India. So that's how ISO 7101 is the first standard which includes person-centered care as a special standard now. So most of it, whatever I've discussed now, is there on the standard. And ISO 7101 talks about collecting feedbacks, collecting surveys, understand how you're going to implement person-centered care within the system. And it talks about the leadership, talks about the governance, and all these things are covered in the person-centered care in the ISO. So the standards are now published, and you can go through it. Thank you.
Thank you so much. So we have the authority right here speaking. Thank you so much for that, Dr. Anuradha. Okay, so at this juncture, we want to present with you, Dr. Anuradha, the certificate of appreciation for imparting valuable insights and inspiration to the participants during the PSQ's March 2024 International Webinar with the topic Implementation of Person-Centered Care in Healthcare with PFCAC on March 21, 2024, signed by yours truly. I'll be sending it over as well via email. And this recording as well, we'll be sending it over to, we'll upload it somewhere in the YouTube environment. We'll be sending it over to all of those ones who were able to register so that you can, hear more about the topic. But some of the participants weren't able to join us today, but definitely you can, grab that recording coming from us that we'll be sending out in a couple of days.
Thank you for the certificate. I feel very honored to get it from your Philippine Society for Quality, and really appreciate your work. Thank you.
Thank you so much, Dr. Anuradha, and hopefully we're going to see you in the future.
Thank you. Yeah, definitely. Thank you so much. Bye then.
Thank you so much. At this juncture, I want to present with you the Philippine Society for Equality. So we are a national professional organization founded in May 17, 1969. And we have a rich history and a commitment to excellence, and we engage in a variety of activities from equality perspective. So we continuously pursue the quality crusade. So if you can join us, our mission to elevate the standards and drive quality excellence right here in the Philippines, that would be great. And be part of our vision, be part of our mission. We are a network of agile, innovative, and trusted partner of choice, and we create value and drive advancement in the quality and organizational excellence perspective. Over the course of decades, like more than 5 decades, we're able to invite some of the renowned or the popular quality gurus of the world, including Dr. Joseph Duran to Dr. Kaoru Ishikawa. And for the past years as well, we're able to invite Dr. Noriaki Kano. I believe hopefully soon we can also invite during the National Quality Forum some of the quality gurus with the emerging quality gurus of the world. We're able to partner with many organizations from around the globe in the different collaborative projects, meaningful projects. And we also run some trainings from all of the topics from quality perspective, even the modern concepts in terms of the quality. We also do that. And we also invite you to please nominate your executives, your leaders to some of the national awards of Philippine Society for Quality, the Duran Medal, Quality Manager of the Year Award, the Philippine Benchmarking Award, Philippine Best Practice Award, PSQ Team Innovation Award, PSQ Team Excellence Award, and the other awards that we have. So we usually send it over to the social media environment, as well as we do email blasts with all of the awards once they are open. PSQ as well is the um, administrator for the Philippine Quality Award or the PQA, which is the highest national recognition for exemplary organizational performance for both the private and public organizations in the country. But from PSQ perspective, we only cater to the private sector because it's the Development Academy of the Philippines that really that oversees the public organizations. Please also, if you're a member of PSQ, please join the different committees that we have so that you can be immersed in terms of the different projects, the meaningful projects that we're doing from PSQ perspective. Be part of the technical hubs that we have right here at the Philippine Society for Equality. So we initially have 5 hubs at this point, and later on we'll have more. And we are now starting to implement some of the initiatives coming from the different hubs that we have. Call for articles. We are extending the call for articles up to April 15th. So looks like you're able to receive it coming from us in the social media environment. So please feel free to send your articles with us, regardless whether you're a member of PSQ or you're not a member of PSQ yet. Please send your articles over to us so that we can screen them, we can evaluate them, and hopefully that can be part of the publication sometime in June for this year. And by the way, if you want to get real-time updates regarding PSQ, all of the events that we're doing, then please sign up to our Viber community. The Duran Medal, as I shared with you earlier, and the Quality Manager of the Year Award, the nominations are now open. So please feel free to nominate your top executives, your senior executives for the Duran Medal, and any of your quality leaders for the QMYA. So we expect more nominations coming from you, and the winners will be recognized during the National Quality Forum that will happen sometime in September. And regarding September, then the Philippines is the chosen host country for the International Quality and Productivity Convention that will be held at the Manila Hotel from September 9 to 12. And this will be followed by the 34th National Quality Forum, the same venue that will be on September 12 to 13. So please check all of the emails coming from us and all of the information or all of the updates coming from us in the Viber community as well as in the social media environment. And with that, I just want to say thank you so much for being with us, and I hope you learned something from our webinar for today in collaboration with ISQA. And thank you so much for spending some time, in your learning, and we'll definitely share with you the recording of our session for today. With that, I'll say good night, everyone, and please take care. And thank you so much once again, Dr. Anuradha. We hope to see you soon. Thank you so much, everyone.
Bye.